If you see this decal outside your GP's clinic, it means it's H1N1 ready. All geared up and ready on standby are the pandemic preparedness clinics. All PPCs around the island will have this seal of approval. The PPCs that include polyclinics as well as private clinics are registered under the Ministry of Health's Influenza Pandemic Response Framework and will be activated when there is evidence of sustained community transmission.
PPCs have decals stating that they are ready. PPCs have been trained, and PPCs are receiving free equipments, the PPEs, from MOH. And of course, the MOH stockpile of Tamiflu, only PPCs get it. Any clinic can sign up for it, but they must do certain things. One, they need to attend a flu workshop, right? To be trained about the disease pattern, how to set up your clinic, right? To receive these patients, what precautions, what logistic requirements, like what gowns, how much of it. Internet access so that you can log in to record the cases that are dispensed Tamiflu. All the staff has to be trained on how to wear the PPEs properly.
A PPC is much more equipped to handle the H1N1 virus as compared to a regular clinic. This means much more precautionary measures are put in place.
We have acquired various equipments, like what we call PPEs, and we have started triaging patients. That means once the patient comes in, we take their temperature and start asking them to fill up declaration forms. Okay, so to know whether they are at risk or not at risk of being an infected patient. Okay, and then if they are at risk, we mask them up and we put them in a corner, what we call a flu area. Right, the rest of the patient will be in the no flu zone, whereas these suspect cases will be in the flu zone. Yeah, and then when I, of course, my staff will be all gowned up, okay, with the PPEs, so that because they are the first contact, so they must not be infected, so they are gowned up when they screen such patients. And when I see these suspect cases, I need to gown up and wear the mask.
But with the community spread of the H1N1 virus gaining momentum, Singaporeans may be concerned about visiting a PPC, especially since they risk exposing themselves to the virus.
The PPCs, they're set up, are ready to receive all kinds of patients. Right, so that the non-flu patients will not get infected by the flu patients. The waiting area you can designate into half flu and half non-flu. Right, you essentially the important thing is that you should maintain the distance of about 2 meters. Okay, flu and non-flu. Right, and then I do have a room that I use for surgery. So that room I use it as an isolation room while waiting for the ambulance to arrive.
The H1N1 virus bears similar symptoms to the common flu. This makes it difficult to contain because many people may not even know that they have contracted the virus.
The seasonal flu and this H1N1 swine flu, the signs and symptoms are very similar. In fact, most of the time you cannot tell difference just by examining patients or asking them. You need to actually send a swab specimen for PCR, which will take about 6 hours, and it's only done in the hospitals. We have certain criteria published by the Ministry of Health, right? They need to have symptoms of upper respiratory diseases, like fever, cough, runny nose, sore throat. And the second criteria would be that they either have come from countries with local transmission of H1N1, or they have been in contact with patients of suffering from H1N1. But when you have local transmission in Singapore, when we go into the mitigation phase, you cannot. So this criteria does not apply anymore. Right, so anybody with fever, cough, sore throat, runny nose can be suffering from it.
We can all take heart that Singaporean doctors are doing their best to help control the virus. So if you fall ill, don't forget that there's always a PPC nearby ready to receive you.